housekeeping that she'd like to share with you. Shani, you're on mute.
Okay, so sorry about that. Thank you all for joining. When we get, so just a few housekeeping, please stay on mute if you're not speaking. When we get to the Q&A, I'd like you to use the raise hand feature, and you can click on participants to find that feature on your phone. If you're not on video, if you're not on a computer, you can raise your hand, I believe, by pressing *6 to raise your hand, and we'll try to get you live so you can ask your question. That'll be later on in the conversation, but that's all for now. Just stay on mute if you are not speaking, and we'll use the raise the hand feature. There's supposed to be a little over 50 people to come on tonight, so that's the best way to keep order. Thank you.
Thank you, Shani. Well, I have the distinct privilege of introducing our three panelists tonight, and I'm excited to hear what they have to say, the knowledge that they're going to impart on us this evening. I'd like to first introduce Dr. Carol Penn. Dr. Penn, could you just raise your hand? There you go, there you go. Dr. Penn is currently the Director of Service Integration with Ocean Health Initiatives, a federally qualified health center based in Monmouth and Ocean counties in New Jersey. She is a staff physician with Metamorphosis, physician assistant weight loss, and formerly served as the acting medical director for Quality Community Healthcare, a federally qualified health center in Philadelphia. During her residency in family medicine, she served as chief resident in family practice medicine at St. Joseph's Hospital, North Philadelphia Hospital System from 2012 to 2013. She is also a National Health Corps Scholar since 2002. She is a clinical assistant professor in the Department of Family Medicine at Rowan University School of Osteopathic Medicine. She is on the faculty of the Center for Mind-Body Medicine in Washington, D.C. She is a mind-body skills group facilitator, a nationally certified health, wellness, and fitness coach, a nationally certified personal trainer, and a health correspondent for WURD Radio and host of her very own podcast, Mind, Body, and Spirit Medicine with Dr. Carol Penn. Dr. Penn is a graduate of Rowan University School of Osteopathic Medicine. And believe me, there was a lot more that I could read. And now I would like to introduce to you Reverend Bertram Johnson. For almost 30 years, Reverend Bertram Johnson has served churches, nonprofit, and faith-based organizations dedicated to social justice, spiritual care, and public health. He has worked nationally in HIV/AIDS research education through Fred Hutchinson Cancer Research Center, promoting awareness and access among communities most disproportionately impacted by the virus. He also has years of experience directing care programs for people living with HIV, mental health concerns, addiction, and as an oncology chaplain. Reverend Johnson currently works as interfaith minister, providing spiritual direction for seminarians at Union Theological Seminary in New York City. He also serves the Presbyterian Church USA as a coach with the Vital Congregations Initiative and helps raise awareness of vaccine research through the faith initiative of the COVID-19 Prevention Network. And last but not least, we have Dr. Ivan Walks. Dr. Ivan Walks is the CEO of Integrated Health Resources, a behavioral health services company, and Ivan Walks and Associates, which is a health and human services consulting firm. He is the chair of the Black Health Trust National COVID-19 Vaccine Committee and a founding board member of the Leadership Council for Healthy Communities. He is a former mental health commissioner for the County of Los Angeles, chief health officer of Washington, D.C., and director of the D.C. Department of Health. He has served on the adjunct medical faculty at both George Washington University and Howard University, and was appointed by the governor to serve as a member of the State of Maryland Board of Education. After the September 11, 2001 attacks, he served on the National Board for the American Red Cross to oversee healthy recovery efforts for those impacted by the events at the Pentagon and the Twin Towers in New York City. Dr. Walks attended the University of Southern California, completed his Doctor of Medicine at the University of California at Davis, and additional training at the UCLA Neuropsychiatric Institute, the U.S. Department of Health and Human Services, and the John F. Kennedy School of Government at Harvard University. Welcome to all three of you. And I believe that based on those bios, we definitely have the right panelists here tonight. So again, thank you for being here. I've asked the three of you to prepare a brief statement from anywhere from 2 to 3 minutes, just to kind of prime the pump tonight for our discussion. So Dr. Penn, would you like to share with us your brief statement?
Absolutely. Good evening, and thank you one and all for the invitation. And also, thank all of the viewers that are here participating in this town hall. So, the big question on everyone's mind really has to do with, the vaccinations. And is it safe? Is this something that that I should take? That's a question. So I hope to be able to address some of those concerns and talk about vaccination hesitancy. I think that this pandemic certainly is giving us all great pause. And it is really asking us to take a look at the healthcare disparities that are being revealed. And it's also asking us to come forward with a new day, with a new plan. We can't afford to go back to business as usual. So I'm looking forward to being on this panel, bringing forward some of my knowledge as well as answering questions. And I'll just let it go at that for now, since we want to keep this short.
Thank you so much, Dr. Penn. Thank you. Reverend Johnson, would you like to share a brief statement?
Yes, thank you. And I'm going to share a brief slide set here with you all. Thank you, Shawnee, for making that possible. Again, my name is Bertram Johnson. I'm at Union and also with the COVID Prevention Network. I'm serving on a team of 7 faith leaders from across the country. Our work is to help raise awareness about COVID prevention research among the communities that are most impacted by the virus. So in our responsibilities, we are working primarily with African Americans, Latinx folks, and Native Americans. Our team is interfaith, and we represent the whole nation. We actually have people who are both working from the Christian and Muslim perspective from those traditions. And we've been doing this work since August of last year. The COVID Prevention Network is made up of 4 research entities that were pre-existing to this research, all of which were focused on HIV and other infectious diseases. And we have 72 partner institutions across the country. So this is a global effort through NIAID, which is the National Institute of Allergies and Infectious Diseases. I'm sure we'll get to these, but I just want to state where we are right now. The COVID right now As of today, according to the CDC, there are over 26 million people who've been diagnosed with COVID-19, and sadly, nearly 500,000, so 445,000 people have died because of the virus. The positive numbers that we can look at right now, we wouldn't have been able to say this just 2 months ago, is that we have nearly 34 million people who received vaccination. So we are making progress. But part of the challenge for us as Black people is that this is information from the Kaiser Family Foundation, is that Black Americans are, Black adults are more reluctant to wait and see, even though there are free options and access to the virus. So you can see we're actually tied with folks who are 18 to 29, but we're less likely to receive, and we're gonna wait and see. And if you look at the bottom of this graph, you can see that even if the vaccine, again, is provided for free, folks are more reluctant to receive, or less reluctant, or excuse me, yes, more reluctant to accept it. So we're down at in the 35%, and we're only, our number's only higher than Republicans. So that may be a statement to us as Black people that we need to consider where we're putting our values and what we want to align ourselves. And misinformation is one of the primary concerns. People say that they don't have enough information. So the work of the network is to help raise awareness. And we're not, I mean, yes, we believe in the vaccine and we believe that it's life-giving and healing for us, but we really just want to provide information so that people can make healthy and informed decisions for themselves and their communities. And then just from a theological perspective, or from a faith perspective, it says in Deuteronomy, "This day I call the heavens and the earth as witness against you that I have set before you life and death." And then basically choose life. So God is saying that there's, in the scriptures, it's saying there are options for life and death. And if there's a means for healing, we encourage people to choose what's going to be healing and offering life for them. And we'll have more time for more in-depth presentation, but I just want to take this time and give an overview of the work of the COVID Prevention Network. So again, thank you.
Thank you, Reverend Johnson. That was very, very informative. Now, I'll ask Dr. Walks. Dr. Walks, if you would please provide a brief opening statement.
Good evening, everyone, and it's good to be with you. Let me start with a quote from the Reverend Jesse Jackson. I was on his radio show a couple of weeks ago, and Reverend Jackson has a way of putting things that sometimes goes right to the heart of the matter. He said, and I quote, "We are the sickest and we are dying the quickest." And I think that pretty much covers it. We need to be paying attention to what's going on with COVID-19. Any set of numbers you look at shows that he's right. So what's going on? Why is it like that? Well, we hear a lot about vaccine hesitancy, and we're going to talk about that. But until everybody who looks like us gets a vaccine, I don't want to hear about vaccine hesitancy, because we're talking about people who don't want to get the vaccine when the people who want to get the vaccine can't get the vaccine. And that is a challenge for us. And I think we have to speak up and say that we need to make sure the vaccine is available in our communities. I've talked to people all across the country, a physician in Maryland that had to wait in line for an hour and a half to get her vaccine, even though it was her turn. A physician in South Central Los Angeles who said when he got there, he was in line behind 2 buses of people that probably have never been to South Central, but they were in line to get the vaccine. A lot of folks who are not 65 and over, who don't look like us, in Washington, D.C., people being sent from upper Northwest to Southeast, because guess what? They ran out in upper Northwest, so they came to get the vaccine in Southeast. So there are a lot of issues that have to do with vaccine distribution and equitable distribution that we have to talk about. I chair the vaccine committee for the Black Health Trust. What that means is we have a group of doctors and other folks from across the country who do our own looking at and recommending about. So we've been working closely with the National Medical Association and all of those African-American doctors. They've been working with the folks who actually made the vaccine and looking at the vaccine results. And so we had folks who followed the FDA review of the vaccine data. And so NMA put out its own recommendation that folks take the vaccine in consultation with their doctor and all of that. And then the Black Health Trust looked at what the NMA did, and we decided we would also, as an organization, recommend that folks get the vaccine. And when research was done to ask folks, who do you depend on for your medical advice? Who do you trust most for your medical advice? People trust their doctors, the doctors that they know. So people that look like us, that are physicians and that are healthcare professionals, are recommending that people that look like us take the vaccine. And some of our other non-medical leaders, I won't name who have put out this story that the COVID vaccine is made by the white people to get rid of Black people. So if you take it, it's poison. Really? Then why are white people knocking Black people out of the way to get to the vaccine? There are things that are bad for us that people are trying to do for us. But when people are trying to get past us to get to something, it usually means that they think it's good and they want it too. So I think we have to be very clear that there is no science that says right now that Black folks should not get the vaccine. And I think we have to find ways, and we can talk about them later as we go along this evening, find ways to educate and motivate. The thing about medicine and science is that we try to educate people. As a former state public health official, in public health, we want to educate you, but we really want you to do something. In public health, it's about getting people to actually do something. And in this particular construct, it's about getting people to get in line, roll up your sleeve, and get the vaccine. And did you say I had 20 minutes, Reverend Peace?
Thank you for enlightening us, Dr. Walks. All of that is very good information. And one of the things that we want to talk about this evening is the distribution, because we want Blacks and Latinos to get the vaccine, but if there's no place for them to get it, then it's a moot point. And what I want to do right now is I want to go back to what Reverend Johnson said, and he talked about the Kaiser Foundation, and he gave some statistics, and I did a little research today as well. And one of the things that we know that is not a secret is that Blacks and Latinos collectively have nearly the lowest rates of vaccination among other ethnic groups. And in fact, Blacks are 3 times, white Americans are vaccinated 3 times greater than Blacks. And so one of the things that I think we need to talk about is, because a lot of people I ask about the vaccine, they have this same hesitancy. I'm going to wait until I see what happens. I'm not ready. I don't trust it. So I think that's the reason why we're really here tonight, is because there is a matter of mistrust. And the reality of it all is that if we look back on history with regards to health care for Blacks and Latinos, is disproportionately less effective, or I should say, we don't get the same kind of care. And so that's one of the issues I want to talk about, just kind of start talking about this evening. And why is it that Blacks should trust the vaccine? And I'll direct that question to Dr. Penn, because you mentioned about the hesitancy in the African-American community with getting the vaccine.
Well, there is historical precedent for the mistrust within Black community, Latino community, Indigenous and Native American populations. We don't have to go back too far in history to recall the Tuskegee and the syphilis experiments. We don't have to go too far back in history to review about Henrietta Lacks and the fact that, her cells were taken from her cervix without her knowledge, and essentially formed the biomedical industry. And of course, that family was not compensated. And, you know, that happened where, you know, at Johns Hopkins University. Black people in Baltimore used to call Hopkins, that's the place where people go to die. So again, this is something that's not in distant history, but all that aside, you have to be aware, but you also have to be smart about this. You have to consider and look at, you know, what this virus is doing to people who look like us, to our population. And then you have to look at, well, you know, what do we have to combat it? Not much, not much. I do think that forums like this are part of the solution, are part of the answer, where people get together and we have the opportunity to communicate, where we have the opportunity to bring the science forward, where we have the opportunity to kind of think collectively and to get beyond this, you know, truly beyond vaccine hesitancy. It's just like, I'm just not going to take it. You know, so what else do we have? And I always tell people, you know, well, what are your alternatives? What are you thinking? Do you know anybody who's gotten COVID-19? Have you seen what it does to the human body for those who get sick, who really get sick from it? Yes. And I know all the way from my own personal family, completely had the virus, tested positive, completely asymptomatic, all the way to a relative right now who was on critical last week. Fortunately, he survived it. He's released this evening. And in the interim, in the last month, 3 family members who have died, who did not survive it. So that's just, you know, on the personal level. So you get out there and you have people saying things like, well, you know, when I get a vaccination, I get the flu. So that's usually what we hear around, you know, not wanting to take the flu vaccine. And truth be told is, I'm going to say it, you don't get the flu from the flu vaccine. Probably, and most likelihood, if you get the flu after getting the flu vaccine, it's because you were already exposed. Now, the mechanism of what people know for the flu vaccine is different than the mechanism of delivery for the COVID-19 vaccines. And right there, because of the difference in the mechanism of delivery, you are not going to get COVID-19 from the COVID-19 vaccinations if you get the Pfizer or the Moderna, which are the 2 that are most widely available at this point. So the old school flu vaccine, which is, you know, we get a lot of pushback and hear about that, you either get a dead virus or you get a weakened or an attenuated virus. So that's where some of that, you know, mythology comes from, because you're actually getting the virus. And this is how our immune system works. We're introduced to a pathogen. Our immune system mounts a response. And in the case of the flu vaccine, it is mounting a response to the actual virus that is either dead or in a weakened form. Right? But you still, and again, people, so I get the idea where people, they feel like, okay, I got the flu vaccine and I got the flu. Now, here comes COVID-19. COVID-19, highly, highly infectious. And you get the vaccination, which is, people might be hearing about this mRNA, messenger RNA. How this works is, it is, once you get the vaccination in your arm, it's delivered in something called a nanoparticle, and it causes the protein that has, you know, the little spikes that you see on the vaccine. It looks like it has these little spikes. It is actually able to replicate that protein. So no virus has been introduced to your body, but once your immune system sees these spikes and these crowns that are formed by these proteins that your body naturally produces, your immune system mounts a response to that. So if it sees the coronavirus, the real one gets introduced, your immune system then attacks that. So there is a safety and an efficacy that's built in the delivery system, the mechanism of action to the vaccination itself. Now, that might sound, difficult or hard to break down, but what I want to try to, tell people and introduce here is that, science has come along. And by the way, this mRNA technology it's not new technology. It's been studied for years in live human studies. That's another kind of misnomer that's like, oh, this is the first time this has been studied in human subjects. No, it's not the first time it's been studied in human subjects. It has been studied with its efficacy against other type of viral infections and pathogens. What's brought forward now, it's like the COVID-19 and this mRNA, which is the Pfizer and the Moderna vaccinations. It was like a good match. Here's the technology, here's the science, here's the information, here is the virus and how it looks. And this messenger RNA is able to replicate how it looks once it's in our system, so our immune system recognizes it and attacks it when the real thing is introduced. So I'm hoping that as people learn about the science, as they hear the information, this will help to quell some of the fears, answer some of the questions, because, in some cases, logic does work. Sometimes people hesitate because they don't know what's being put forward. So I'm very hopeful that this forum tonight, with the nuggets and the pearls that are being shared, are going to be encouraging. And again, all the studies do show that when a doctor that looks like you, that you come to trust, is sharing information with you, the chances are that you're going to go ahead and you'll be able to go along with or accept the recommendations that they're making. So I'm hoping tonight that after tonight's panel is over, people will be able to accept the recommendations that are being made, and will save a lot of lives, including your own.
So Dr.
Thank
Penn,
you, Dr. Penn. Go.
I was going to say, I'm a lay person in this conversation. I'm a community educator. So what I heard you say was that, one is that there is no coronavirus in the COVID-19 in the vaccine.
Correct.
So no fear or worry of actually being given COVID-19 through a vaccination.
Correct.
And two, what the vaccine does is actually it sends messenger RNA, or we could say cells, or I don't know, medicine to recognize the virus if it were to show up in your system, and to kill it, to stop it. That's what the mRNA does, correct?
That, yes, that's very close to, to what it does. So it's sort of like, I think everybody knows the term decoy. You know what a decoy is? So, you put the decoy in the water to, and it looks like a duck, and that brings the other ducks around it. So if you could think of the messenger RNA vaccine technology like a decoy, and then when your immune system gathers around it because it thinks it's seeing a duck, then it is going to behave, accordingly. But there is no actual duck there. That, that decoy is, it's wood and paint, it's carved wood and paint. And that's what the messenger RNA is like. So there is no COVID-19 being injected into your body, which is like the difference. So with flu vaccine, which is what most of us know, yeah, there was influenza being injected into your body, either a dead virus or a weakened virus. And that's the biggest difference.
Thank you, Dr. Penn. Thank you very much for that explanation. I have some questions here that I want to try to get through this evening. And I am going to ask Dr. Walks this particular question. Right now, there are 2 approved vaccines out there. Is there one that's better than the other? And if so, why?
So of the 2 vaccines that are out, there really isn't much of a difference in terms of efficacy. When people say better, what in layman's terms, I tend to understand things pretty simply. So when you tell me better, what I'm one is it going to hurt me less, and is it going to do more? That's what makes it better. And so the 2 vaccines they're both going to work about the same. They both have about the same level of efficacy, and neither one of them is going to give you COVID-19 or give you coronavirus. Now, let me just expand a little bit, because there are other vaccines that are coming down the pike very, very soon that don't have the same level of efficacy. Now, what does that mean? That means they don't work quite as well to prevent you from getting sick with COVID-19. We've heard, and this is what's a little bit confusing for a lot of folks, so I'm going to try to clear it up, even though it's still kind of unclear. We've been hearing for months that the Pfizer vaccine is 95% effective. The Moderna vaccine is 94.1% effective. And those numbers have meant something to the people who are saying it. The flu vaccine that we doctors recommend every year, it's about 40 to 60% effective. And we still recommend it, because 40 to 60% is pretty good. And if these coronavirus vaccines had come out at 70%, we would have been jumping up and down saying how happy we were that we had a vaccine that was 70% effective. And let me just clarify one thing about the flu vaccine. It may have attenuated or killed virus, but it's not virus that can make you sick. When you get sick from the flu vaccine, as Dr. Penn said, you probably got exposed to the flu. And because the vaccine is only 40 to 60% effective, you got the flu. Not because the vaccine gave you the flu, but, the Lord allowed you to get the flu. He didn't give it to you, but he allowed you to get the flu. Okay, so stop blaming the flu vaccine for giving you the flu. Now, to the vaccines that are coming out, they are likely going to be less than 95% effective. And part of that is because we've got variants, right? So we got the South Africa virus, the South Africa variant, the Brazilian variant, the UK variant, and even the Pfizer and Moderna vaccines are differently efficacious for those different variants of the vaccine. What does all of that mean? We don't have enough vaccine for everybody right now. So if somebody offers you one, take it. That's what that means. That's the bottom line right now. We don't have enough vaccines for everybody. The vaccines work. They can save your life. And all of that stuff about, well, the new ones are effective at preventing severe disease, or they don't. If you get a vaccine, take it. I'm happy to spend another hour and explain what all of that means, but I don't think that's what you guys want. We can talk about the 351 variant and all of the we don't need to do all that. We need to make sure that people are clear that just about there are a couple of wacky anti-vaxxer doctors out there, but most of you have a doctor that you know and that you trust, or you can find one, and all of them will say the vaccines are safe and effective, and you should take the vaccine, whichever one is offered to you. Pfizer, 3 weeks between the dosing. Moderna, 4 weeks between the dosing. Some of the newer ones, maybe just a single dose is going to be effective. But until we have choices, which is going to be at least 8-10 months from now, take whatever vaccine you can, so you'll be alive 8 to 10 months from now.
Yeah. Thank you. So what you're saying is take what you can get, because even a 70% effective or 60% effective is better than no efficacy at all.
Let me just say quickly, Pastor Peace, One of the reasons why that's important is because we're trying to do two things at the same time. We're trying to prevent individual people, us, from getting sick. And we're trying to create this thing they talk about, which is herd immunity. If the virus can't infect me because I'm immunized, then the virus can't grow in me and I can't spread the virus to other people. And so the virus gets to me, but it can't make me sick. And if I can't get sick, it's likely that I can't give it to someone else and they can't get sick. And that's what stops the spread. In the meantime, really, 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 really important. Wear your mask, wash your hands, get a good mask. Don't believe you can't get an N95. They sell them at Costco. You can order them at Costco.com and wait safely at home until they're delivered. It was in the Costco magazine that came to my house yesterday. The NIOSH N95 mask, you can order it. So please wear your mask, wash your hands, get your vaccine.
So since we're talking about, the effectiveness of the vaccines, it's from my understanding that even if you take the vaccine, you still may get virus in your nasal passages that might be concerning as well. Perhaps not as concerning as if it's in your lungs, in your airways, but in your nasal passage, there's still some concern, not as much. Could you share a little bit with us about that?
Just really, really quickly. The virus gets into your nasal passages, into your lungs. And what does it do if you're not vaccinated and not protected? It multiplies. That's what viruses can't live without a cell host. So they get into your cells and they multiply. If you are protected, as Dr. Penn very clearly told us, your immune system is ready. It's like, okay, virus, come on, bam. And it doesn't allow the virus to get in you and multiply. So yes, you may get a certain viral load, which is the amount of virus that you get. It's in your nose. And if you sneeze and you're nasty, yes, that comes in, you can sneeze it out. But that's not what we worry about. We worry about people getting virus in. It's replicating in us. And then we're talking it out and we're sneezing it out and making other people sick.
Thank you. Thank you. Reverend Johnson, I'm not leaving you out.
No, I'm fine. But can I make a comment on the last?
Sure. Absolutely.
As I understand it, and so I'm, again, the layperson here with two medical doctors. As I understand it, the vaccination actually, it doesn't prevent you from getting coronavirus. It prevents coronavirus from becoming COVID-19. So you may be exposed to coronavirus, but COVID-19 is the response that has people in the hospital that's caused people to die. And I invite either of the doctors to respond to that as they understand it.
COVID-19 is the name of the disease, and the COV is coronavirus from 2019. That's where you get COVID-19. Mm-hmm. That's kind of, as my mama would say, that's a distinction without a difference. Yeah. If you have this thing and you are sick, you have it and you are sick. But what we want is we don't want to have a reservoir or a safe place for the virus to replicate. And that's what Dr. Penn was talking about with your body preparing. So when the virus comes in, because it's still going to be around, your body is saying, oh no, I'm ready for you and I'm going to kill whatever comes in. This is not a good place for you to be. It's not safe. Virus, you come in here, I'm ready for you. I'm primed. I'm going to get you, which is one reason why when people get that second dose, sometimes of the Pfizer or the Moderna, and it primes their system, your system is reacting. And that's why sometimes people say, oh, I took that shot and I was sick for a day. I promise you, if you get sick with the real COVID-19 coronavirus, you will not be sick for just a day. But when your immune system is being primed with that second shot, you may be sick for a day or two because of your immune system's response, not because you're getting sick with COVID-19.
Yeah, exactly. And, 1 or 2 days of, being inconvenienced, slight fever, muscle aches, that is nothing compared to just, that air hunger when your body, your pulmonary system is shutting down. That's, you know, it's absolutely nothing compared to what you would suffer if you actually get the COVID-19, and have one of the more severe cases. I mean, you know, it's like, you know, everybody, you know, you might feel like you're coming down with something, feel a little bit of achy, you know, you take your Tylenol and take your Advil, and most people are able just to go on with their work day. And, you know, they might be a little bit tired. I know I've had, you know, personal confection, you know, we can't say we want you and then we don't. I've had my first shot. I had the Moderna, and yeah, my arm after a couple of hours felt like I had, you know, a tetanus shot. It got sore and it aches for a day, but that was it. That was it. Now, tomorrow morning, I get my second vaccination, and I'll see what, you know, how my body's going to respond to that. But I can tell you, with what I see, the impact that this virus has on the human body, a vaccination, it pales in comparison to a few hours of inconvenience. This and what we're not talking about, because we haven't even gotten to that yet, talking about in the general public, not here tonight, is the COVID long haulers, the people who are suffering for months and months and months after having COVID-19, maybe even surviving a hospitalization. But, you know, now they're struggling with pulmonary disorders, struggling with cardiovascular disorders, struggling with ongoing pain, brain fog, the morbidity, you know, they can't go to work because of constant fatigue, because of constant shortness of breath. So that's going to be a whole nother issue that we have to deal with the COVID long haulers. And these vaccinations are designed to prevent all of that. So again, you know, think about it. Think about the risk that you're taking if you don't get it, to yourself personally and to the people around you. Mm-hmm. And you got to think about, what kind of community do you want to live in? What kind of life do you want to have? This could go on for years and years and years, or we could work together and we can nip it in the bud and we can stop this.
Yes, Dr. Penn, I think it's very important that we do nip it in the bud. You brought something up that's very significant, and that is the long haulers. I know people now who are suffering because they're part of that category of long haulers. And so I want to direct the next question to Reverend Johnson. I want to know a little bit more about how your Vital Congregations initiative is helping to raise the awareness of vaccine research, as well as the need to take the vaccines. It's important that we make people aware of what we've been talking about this evening. And so I just want to ask Reverend Johnson, how is the Vital Congregations initiative helping in that manner?
Yeah, so it's actually it's the faith initiative of the COVID Prevention Network. And our work, like I said earlier, is that I'm serving with a team of 7 faith leaders from around the country. And our work is really to have these conversations, to help facilitate these conversations in communities where people need it most. I mean, as you can tell, African Americans are suffering at a higher rate than pretty much any other group in the country, well, alongside Native Americans and Latinx folks. And so we produce ongoing conversations. There's a video series I'm going to put into the chat later on called COVID in Black, which is speaking specifically to the Black community. There are 5 episodes thus far. And we're also working with faith leaders like yourselves. And the hope is that, and the research shows that once someone in your community gets the virus, gets the vaccine, gets vaccinated, and they speak positively of it, then more folks are inclined to do that. So if you think of your family network or your church or your neighborhood, and so if we can partner with folks who have received the vaccine already and use them as spokespersons and use them as testimonials to say, yeah, as Dr. Penn said, yes, I got the shot. I was a little sore, but I'm going back for my second shot. I talked to my uncle today, who's like, I got my first shot. I get my second shot in 2 weeks. But I also have family members who are reluctant to do that. And so I'm trying to, the work is to help create conversation between people who know each other and trust each other so that there's open, frank conversation. There's no sense of bias or manipulation so that we can impact as many lives, especially in the Black community, because as we talked about medical mistrust, a sense of being exploited by medical professionals in the past. And if you have someone who you trust, a faith leader, a pastor, a community leader, someone who looks like you and speaks like you, then you're more inclined to receive be open to the vaccine instead of someone who was coming in from outside of your community doing that work.
Thank you. Thank you. So one of the things I want to talk about as well is how do we propose to get this vaccine into the communities? That was mentioned earlier by Dr. Walks as well as Dr. Penn, because we know that a lot of our people don't have access to where they have these super centers for providing the vaccine and that sort of thing. How do we get the vaccine to those places where our people are? Anyone?
We first of all have to make sure that the people whose job it is to distribute the vaccine understand who they're serving. I was very disappointed to read about what happened in Shelby County in Tennessee, and anyone can just look up Shelby County. It's all over. And we talked about this on the Black Health Trust last week, how they set up vaccinations for folks, but only allowed people online to sign up in a county where a lot of people don't have internet access. And then 2 days later, they opened up a phone line, but by then all the appointments were gone. So we have to make sure that there's real access, not just somebody saying that things are happening in our community. When you have drive-up vaccination centers, a lot of folks don't have a car. And so if you don't have a car and it's only drive-up, you can't go. So I think we have to be, and I think Reverend Johnson's approach is really, really important, because if you can get the people who understand the community mobilized to talk to the people who are the public health folks making the decisions. When I was a state public health officer, I was appointed by somebody who was elected. And so the answer to the question in the medium and longer term is we have to vote. Other folks vote. And when you vote, the people that are elected pay attention to what you need. You cannot touch the Black and brown community without touching disparities. And the disparities are not just in opinion. The National Academy of Sciences put out a report about a lowering of life expectancy by 2 to 3 years in Black and brown communities, and only 0.68 years in the white community, and that's just from COVID, right? So we know that the opportunity is there for us to do better, and I think that grassroots campaigns, people who are already trusted, already in the community, like what Reverend Johnson and his group are doing. There's another pastor I talked with, Reverend Pinter, up in northern New York, who has done some just amazing work with the rate of infection and rate of death in his community. This is a time for leadership. And so we can lead in our communities, and we can ask folks to do what is right. And then we can have, like Dr. Penn just did, say what we're doing. You know, hey, I got my first shot and it was the Moderna. I wanted the Pfizer so I can get my second shot sooner, but I got the Moderna and my second shot is due next week. So we just, and because it's because I still see patients, and I don't think that it's good for all the doctors to jump the line or anybody else to jump the line. I think that we have to take the vaccine when it's our turn and I think we have to pay attention to what's going on. Reach out to your elected officials, let them know that you are concerned, that you care about when the vaccine is coming to your community. Maybe they can do things like show some ID that you live around here, that you didn't just come off a bus from 20 miles away taking the vaccine that's for this community. I don't think that's an unreasonable thing to ask people to do.
Thank you. Dr. Penn, as a physician, as a doctor, how are you getting out the awareness of the need to take this vaccine?
Well, one of the things I'm doing, I am talking to anybody and everybody who will listen. My patients, not my patients. It is so important. I'm involved on a board of trustees of an organization that addresses food access issues. And so we're talking about to the community that we serve in Monmouth and Ocean counties. So again, part of it is, because we don't have like, a central mandate, all this access is individual from state to state. You do have to be politically involved. You do have to be the squeaky wheel that's going to get the oil. So as a person, as an individual, as a patient, you have to ask, call the local churches, call your mayors, call your town councils, call your police departments. Where and when is this vaccine going to be given? I want to be vaccinated. My family members want to be vaccinated, and trust and believe something is going to eventually manifest. The sooner the better. The other thing that I'm doing is I'm very active on social media. So I'm talking a lot generally about healthcare disparities to bring attention, and any opportunity that I get to be in front of an audience talking about both the healthcare disparities. The other night, I was invited to give a talk on obesity, overweight and obesity, and that alone is a risk factor for morbidity and mortality in COVID-19, despite anything else. So again, it was an opportunity for me to remind people of that and say, look, you've got to take care of your health. And this is why you have to take care of your health. If you have this, if you have this, if you have this, your risk factors for suffering from COVID-19 go up, and they go up exponentially. So it's really being vocal. It's what we're all doing here tonight. And again, when we're talking about, I'm really concerned about the COVID long haulers. And I think what Pastor Johnson is doing in that kind of initiative, we are going to need to walk hand in hand with our faith and with the God of our understanding to survive psychologically and spiritually as we continue to make our way through this pandemic. So it's multifactorial. We all have to keep coming together. I hope that you will have us back here, not just one more time, but 2 or 3 more times, because COVID-19 is going to be with us. At least I believe into 2022. It's not going to magically disappear. And yes, someone was asking in the chat, can you get the virus after taking the vaccine? Yes, which is why you have to continue to wear your mask, wash your hands, and socially distance. All of these approaches have to be going on simultaneously. They're all critical at this time.
And let me just say, and the reason that you can get it again is because the vaccine is 95%, not 100%. So you're going to have some people who can get it again, and the vaccine is not even 95%. We don't think yet, the research is still out on some of the variants, like the South African variant. So we have to, again, take what you can get now and stay tuned, because viruses change. That's why they make a different flu shot every year. Viruses can mutate, viruses can change, and there are some strategies, and when we get to that point, in terms of how to talk to people about getting the vaccine. There are a lot of folks who do a lot of research on a lot of things. And one of the things that folks have done research on at the national level is how do you talk to people and who talks to those people about that? And we're doing part of it now.
Thank you. Thank you.
I do want to add one other thing, though, because this is a faith conversation. We've seen in some different states that are partnering with, the state health departments are partnering with faith institutions, and they're becoming vaccination stations. And so I'm not sure, people are representing different congregations. You're in DC, so that's DC, Maryland, and Virginia. But if there's a way for your congregation to partner with the health department in your local area to either be a distribution center or helping just raise awareness in the community, that's one role that faith communities can play in this work.
So, the church that I attend is working with the county health department, and we will be setting up a vaccine center in our church. So. And
that church is in where?
Celebration Church in Columbia, Maryland. I mean, you got 45,000 square feet and you can't go to church. So use it for something.
Exactly.
And along those lines, our church as well, New Hope Presbyterian Church, is working with the county as well to set up a center where people can come in and do vaccinations. We were actually in line as a testing site as well, but it got cold, and so that didn't work out. A drive-through testing site, but that didn't work out. One of the things people don't realize is that this virus has an effect on just about every aspect of life: economy, the healthcare system, employment, all of that. But what people don't realize is just because COVID goes away, someone may have COVID and it goes away, they're healed. They don't realize, but insurance companies, there are a lot of insurance companies right now, life insurance companies, that won't insure a person if they've had COVID-19 because they really don't know what the long-term effects will be. And so people don't realize that. And I think that's a message that we need to get out to our people as well, that there are long-term aspects of this particular virus, not just health-wise, but insurance, healthcare, and all of that. So just wanted to throw that out there. I think we're at this point of time where we want to take some questions from the floor. Before we do that, is there anything that either of you want to say that's kind of burning right now that you want to share before we open it up for the floor, or to the floor? Okay, all right. Well, I have some questions that have been left in the chat room, and I'm going to go through them now. The first question is, as the decor works, this is directed to you, Dr. Penn. As the decor works, is that why you feel symptoms of the virus, such as fever, chills, headache, etc.?
Well, those symptoms are your signal, and you should be saying, hooray, hallelujah, my immune system is working. And this is how you know your immune system is working, because you are getting a low-grade fever, or you're getting some little chills. So this is your immune system gearing up and saying, I see the enemy and I am ready to fight it. And so that should be really reassuring, that you have that, not, feeling so well. You're probably not going to feel that too much after the first vaccination, but people are reporting this more so after the second one, because when you introduce it the second time, it's like, oh yes, I remember this. I saw you before, and you are not me. I recognize you as foreign. So that's a good thing.
Thank you. And as you speak about the second shot, I actually got my second shot yesterday, and I feel absolutely wonderful. So,
Excellent.
All right. The next question is, and I think this has been answered already. Can you get the virus after taking the vaccine?
Yes.
And I think there's a yes on that. Okay. Let's see. I've had the first dose on the 30th of January and second dose due on the 1st of March. Is that too long between doses?
No.
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 That's only 4 weeks, really.
Yeah.
Yeah. I think Pfizer.
And then even if it's the Pfizer vaccine, if you can't get that second dose right at 3 weeks, then you get it as soon as you can. You don't just give up and say, well, I'll start over again 6 months from now. You get it as soon as you can.
Right.
Yeah. All right. Does the vaccine affect the reproductive system? That's a question I think I've seen quite often. Does the vaccine affect the reproductive system?
So there is no hard science at this point that shows. We have studied pregnant women and they are all okay. There's also no result where a pregnant woman has had a bad outcome from taking the vaccine. A lot of folks who did not know they were pregnant were in the trials and took the vaccine and they're fine. So I am not an obstetrician, but I've talked to obstetricians who are not saying to their patients, you're pregnant, don't take the vaccine. I've talked to a pregnant woman who said, I'm not taking it because I'm going to wait the next 2 months until I have my baby and then I'm going to take it. Again, there's no hard science that says that the vaccine is safe. That research will happen, but there have been pregnant folks who got the vaccine, and I haven't seen any report. Maybe if you've seen one, Dr. Penn or Reverend Johnson, that says that pregnant women have had a bad outcome or babies have had a bad outcome. I haven't seen anything like that.
No, I haven't seen any like that, but we do know that pregnant women who get COVID-19 get very, very, very ill.
Yes.
And they seem to get iller than their age mates, their counterparts who aren't pregnant. So again, you're weighing it, you're getting all the information, you're making an informed choice, and we are recommending that you make the choice that says yes to life. Don't take the chance. It simply isn't worth it from what we're seeing for people who aren't protected.
And there is research coming forward, but it's not available at this time. There was a question about youth and children. There have not been longitudinal studies that have given us information on youth and children in response, but they are actually happening. So pregnant women, youth and children, different special populations will be conducted, but research will be conducted. But at this point, most of the findings regarding the Pfizer and Moderna products were really on the general public, which was, I think, combined over 70,000 people between those two trials in the US.
Thank you. I have another question here. I got my shot about 15 minutes before it was to expire. Is it still good?
Yes.
Yes. Yes.
There are people wandering around places where they are giving the shots, hoping that at the end of the day, some people haven't shown up and they can get a shot. I know people that somebody was walking through, I think it was a Safeway or a Giant, and the pharmacist came out. Anybody here hasn't gotten their shot yet? We have some extra doses. So even if it's 5 minutes before it expires, go and get your shot.
Yeah.
Yeah, when I got my shot, I think they had 6 more left. And of the 6, I was number 2 because it was at the end of the day. And they wanted people to come in to get shots because, they didn't want to waste that.
Right.
And so I thought that was pretty interesting. They were actually in the hallway looking for people, asking them if they wanted to get a shot. Yeah. So
we're not advising everyone go hang out at Safeway or Giant.
All right. Okay. I don't have any other questions. Are there any questions from the floor? I know that a lot of you have sent your questions in, but if you have any more questions, you're free to raise your hand. And
I just added the link to a video series, as I mentioned, from the COVID Prevention Network called COVID in Black. It's so far there are 5 episodes of Black researchers, Black doctors, Black community leaders who are speaking specifically to some of the health disparities or social determinants of health, like those issues in our communities that prevent us, that cause us to have impaired health. It's not something unique to Black people. It's the way that Black people are treated in a white supremacist system. And so that series, the link there will give you exposure on YouTube to COVID in Black. And so I encourage people to look at that. It will be a continuation and sort of an expansion of some of the conversation we're having today.
Thank you.
I have a question. Hello?
Yes. Yes.
My question, are you contagious or a spreader after you've received your first shot, to other people who have not had the shot?
Very good question. Very good question.
That's a great question. And here's the answer. Assume that you are. We are not at a point right now where anybody, whether you've had one shot or both shots, should be saying, well, I'm not contagious. I don't need to wear my mask. I don't need to wash my hands. I can be all up on everybody else. We are not there. We are recommending that even after you get your shot, continue to wear your mask, wash your hands, keep your distance. Why? Why would you need to? You're probably not, because you want to model the right behavior for everybody else. We need an entire culture shift where people are concerned about protecting each other. And we don't know absolutely that every single particle of virus is not going to be blowing around in your nose or in your mouth as you're talking. So please don't assume that because you've gotten both shots or one shot that you can take off your mask and go everywhere. Just don't.
Thank you.
Yeah, and you also have to remember about the variations. We don't know how much coverage having the vaccination is going to give you on the new variants and this rapidly mutating virus. So again, it has to be a multifactorial approach for the foreseeable future. So A, get your vaccination, then B, continue. Wear your mask, wash your hands, social distance.
Vaccination.
I'm sorry, Dr. Reverend Johnson, go ahead.
No, I was just going to say that the vaccination is really there to protect you, but there are people who, you can be asymptomatic. Everyone's heard that term. So you can carry the virus. You can be protected, but you could actually carry the virus and infect someone else. And that's happened within some family groups where children who didn't know they were sick, impaired their parents or grandparents. And so all the precautions are still necessary, even though you've had the vaccination.
And let me just add one thing about wearing masks. We've heard over the last year a lot of different mask recommendations. The first one was, well, you don't really need a mask. Well, we learned more, and we learned that you do need a mask. And then it was just wear some sort of a face covering. And people are wearing bandanas, or they're wearing something very, very light and made of some material you can see through and breathe through and everything else like that. it's important to wear a quality mask. The mask isn't just a fashion statement. The mask is really there to try to limit those little tiny particles that we can't even see going from one person into the air where another person can breathe them. So you'll see folks, a lot of science folks wearing a double mask, or they're wearing the N95 quality mask inside of that fashionable kente cloth or whatever it is you want to wear on the outside. There's nothing wrong with having a fancy mask on, but make sure that you are using something that prevents air from going, well, little particles in the air from going from you to someone else.
I have a question and a comment, if I may. My question is the vaccination going to be an annual thing like the flu shot? We take it annually? That's my question. My comment is on the distribution. And I don't expect that we would have an answer here tonight, but I think there are some concerns about the distribution because we have people who fit in category, I guess, 1 or A, yes, A, who are having to call around to various places to try to get the vaccine. Now, the concern I have is I pastor an older congregation, and many of them do not use the technology that some of us use, and they are really disadvantaged. Yeah. So in terms of the distribution, that concerns me. I have a 94-year-old who has been calling, trying to get the vaccine for 2 weeks.
I think, unfortunately, that's going to take, continued effort, continued persistence, and also at the same time, the political action, the awareness, calling every place and any place, and really pressing the point to get the attention and to get the services that are needed. So, that's one set of issues. And right now, to your other question, the jury's still out. We don't know if this is going to have to be an annual event, the way the influenza vaccination is an annual. If I had to take a guess, I would guess that yes, it is going to have to be an annual because of the nature of viruses themselves. Viruses mutate, viruses adapt, viruses change so that they can find a host and match themselves in that host. So if the nature of virus remains the same, I think we are going to have to look at or think about the likely possibility that we're going to have to get vaccinated annually, or at least every other year.
Thank you.
And let me just add, yes, I agree. We just don't know at this point. But this concern about the individual that's 94 years old and can't figure things out, this is why the younger people need to be available to those who are less young. Someone who might be able to say, you know what, I'll get online for you. The computer doesn't care who you are. Let me help. Let's get the youth group to work with the seniors and get online. So I think that there are opportunities at times like that for us to help each other. I know a lot of churches have like a technology ministry, just like they have a health ministry, especially now when people are trying to go to church online, on Zoom or YouTube or what have you. There are people in congregations who are helping other folks get online, and this is no different.
Thank you. That's a great idea about the young people, the youth group, just setting up some kind of system or a way that they're going to make those phone calls for people who don't have those resources. I have another question here, and the question is, do you think this will eventually be a part of school immunizations like measles? Would anyone?
I think so. I think I don't have any evidence to say that it will be. I think that there's enough concern, and this is a deadly enough illness. And let's not forget, Dr. Penn spoke a couple of times about the long haulers. Not everybody who gets this dies. There are at least 2 cases I've seen where people have had to have a double lung transplant. For the rest of your life, you are severely compromised with a double lung transplant, but you are not on the list of people who died. So let's understand how serious this is. And if there's an opportunity to vaccinate young people safely and to protect them and the grandparents who raise a lot of them and their teachers, who some of whom are older, and I think we should be prepared that we may have to get vaccinated to go to concerts, to go on airplanes at some point. I don't know what's going to happen, but I think that this is a serious enough condition, illness, problem, pandemic, syndemic that's killed enough people that we should be prepared that those choices may be taken away from us at some point.
So whose responsibility do you believe, not pointing fingers, to get the word out? Black neighborhoods, you mentioned a lot of us being compromised, but I don't see any activity either by politicians or the Department of Health. Is it money that is keeping this from not being talked about?
Oh, don't get me started. We just recently had somebody in the White House who was saying that it wasn't real, that it's going to go away, and don't worry, as soon as the weather changes. Now we have someone in the White House who is pushing to get a lot of money out, and a lot of it is to do things like getting efforts into the community. I was on a call today with some folks at the highest levels of the administration, who are the national administration, who are looking at partnering with community groups. There is an effort called, oh gosh, where is it? There's an effort that I was talking with folks about called Choose Healthy Life, that Reverend Calvin Butts from Abyssinia in New York and Reverend Al Sharpton and the United Way, they've kicked off with communities all around the country. Some of the really prominent African-American physicians in the NMA and other folks have a lot of efforts to get information out into the African-American communities. So this is the opportunity now to get the message out is ramping up. And you should hear more and more from organizations like Reverend Johnson's organization, from some of the other ones that I mentioned. And if anybody comes into your community, I'm sorry to talk so much, but I really feel a certain kind of way about this. If someone comes into your community and all they're trying to do is to get you to take the vaccine, yes, that's great. Take the vaccine. At the same time, try to have a conversation with them about why it is that the healthcare system has so much discontinuity, inequity, and why are we getting the sickest and dying the quickest? Why is everything that kills Black and brown people more common in many of our communities? This is an opportunity for us, because I don't want to be too cynical, and y'all just pray for me, because I believe, at least part of me believes, that the only reason they're so concerned about getting all of us vaccinated is because if we all get vaccinated, it saves everybody else. Herd immunity is real. And the more we get vaccinated, the more it protects everyone. But when they come to protect our community, ask those questions, find out who the elected officials are, make sure they care about the people living in these communities, and tell them, you know, I'm registered to vote. You know, I'm a voter.
Amen.
We have about 4 more minutes left, but there are I do want to get this question out, and it is, what would you say to people who are reluctant to take the vaccine and use the Tuskegee experiment as their reason?
You know, that is a tough one. And it's this thing, that goes in this concentric circle. Yes, that did happen. And this is a time that we all need to learn our history, because that and more happened. And we need to push this political agenda and say, yeah, and what about that? Say, yeah, I know I need to get my vaccination, and I understand that. And yes, I vote, but let's go back and let's review some of this history, and let's talk about this. And what are you prepared to do in my community to make sure that these disparities are lessened? Talk to that politician, talk to that business. Are you willing to, we know the research is showing that we need more Black doctors, and that's more efficacious for health, for well-being, for longevity. Are you willing to help create a scholarship fund so people can get a hand up, not a handout, but a hand up, so we can, equalize this playing field? Can I get you in touch with the National Medical Association? Are you willing to come and talk, in a town hall? Ask the next question. So yeah, we got to take a look back, and there's things that happened in the history that we need to make sure never happen again. And it does start with making sure there are more Black doctors, more Black scientists. So will you put your money where your mouth is? And let's see if we can, you ask these questions, and at the same time, protecting yourself. And was it Dr. Waltz would say, look, anytime you see a busload of white folk where you usually don't see a busload of white folk, and they're, knocking you out because there's some vaccinations and they're getting those vaccinations, that also tells you something. Because they wouldn't be trying to get to the head of the line to get the vaccination if it wasn't something that was needed. So we have to look at all these things all the time. We have to be vocal.
Where you will see us, which I think is a wonderful way for distribution, food trucks. Mm-hmm. If we had food trucks on our corners to give out the information or give the vaccination, we would get the message out very fast.
That's a brilliant idea. Food trucks, barbershops, beauty shops, campaigns that have been run through barbershops and beauty shops, public health campaigns have been significantly successful in the past and have made a difference in those communities. So that's a wonderful idea. Again, why these forums are so important.
They are, and there actually is an organization that's linked directly to the School of Public Health at the University of Maryland. That is an organization of barbershops that are used for public health information. So it's there. Can I just say this question about Tuskegee is very important. The Tuskegee experiment. So here's the answer. When someone says, well, what about Tuskegee? I don't trust those people. Okay, Dr. Penn said it. There were no white people lining up to become part of the Tuskegee experiment.
Right.
It wasn't happening. There was no National Medical Association that had done research on Tuskegee and telling you it was time to line up for Tuskegee. It's absolutely not the same thing. It doesn't make Tuskegee any less real. It doesn't make the Black physician, the woman who recorded basically her death from mistreatment with COVID last year. That's you don't have to go all the way back to, you can go back to last week, not to Tuskegee, to see inequities in healthcare. But in none of those cases were there NMA doctors who had reviewed the FDA review of the research that led to the vaccine getting an emergency use authorization. That didn't happen in any of those cases. And there weren't people getting bussed in from affluent communities to take the vaccine that was sent to our community. So Dr. Penn had it right on point. When you see folks pulling up in busloads and pushing you out the way, you might want to look twice and push them back and get in line.
Okay, I have a question. A household of 5. One person was diagnosed with COVID. Another person was sick for 3 weeks, but said they didn't have COVID, and the other 3 did not get it. So I don't quite understand that, but also I want to know if you did have it, and I know you say you can get it again. Is there a time in between when you can get it again, and how long can you shed the virus?
So all of those questions have to do with how should I be behaving, right? And I'm going to just say that behave like if you can get it, and behave like if you can spread it. Wear your mask, something that will prevent your exchanging the droplets that have the virus in them. Wash your hands. And if somebody in your house is sick, COVID-19 is not the flu, but we've all had the flu at some point. And I'm not trying to be all up in your face when you have the flu. I'm just not, right? Who wants to kiss the person with the flu? Nobody does. And so if somebody in your house is sick, it doesn't matter whether their test comes back positive or negative. Why? Because sometimes your test can come back negative and you have COVID, right? We don't have a 100% test. So I always like things really simple, okay? If the fire is hot, don't put your hand in it. Very, very simple, right? We are in the middle of a pandemic, and this is not the time to take a risk and say, well, I had it. I read something that I can't get it again for 2 weeks or 6 weeks. Dr. Penn told you there are variants. They're different. They're acting differently than the one that we've been dealing with for the last year, right? So it's not that I'm trying to avoid the question. I just don't want, this is public health, and public health is about behavior. And I want folks to have information, but I'm really focused on the behavior. This is what we are asking you to do. We're asking you to do all those public health behaviors that keep you safe, and we're asking you to get in line and roll up your sleeve as soon as the vaccine is available and take your shot after you consult with your doctor if you have any sort of health issue. I'm not giving you advice as your personal physician. I'm saying if you have some sort of health issue, a lot of us have high blood pressure, diabetes, asthma, sickle cell. There are all of these things that make us a little bit different, right? We're all God's children, but we're all a little bit different. And so talk to your healthcare professional about your particular, as Dr. Penn said earlier, risk benefit for you on the vaccine, and then try to find an organization like Reverend, I keep wanting to call you Dr. Johnson. I'm just calling you the Reverend Dr. Johnson.
I'll receive it in this context. I receive it in the spirit it was given.
Absolutely. Because it's in a spirit of love and inclusion. I think that we don't all have to have immunology degrees to understand this. This is really basic behavior. Act like if you have it, act like if you can spread it, protect everyone from you, and protect yourself from everyone else.
Thank you. And this is the absolute last question.
Can I make a brief comment before you get there?
Sure, absolutely.
Getting back to Tuskegee, one distinction between coronavirus and COVID-19 and Tuskegee was that the men who were actually in that trial were denied care.
Right.
And so they weren't actually given, they were not given syphilis. They weren't given something to make them sick. They were denied care. So people like to bring up Tuskegee because it was atrocious. It's immoral and evil what the medical community did at that point, but they weren't given something that they know that was going to hurt them. And coronavirus, the vaccination is not that. It doesn't line up, even though we should be aware of what happened and bring greater awareness to Tuskegee, but actually put out the accurate information as to what happened.
So let's talk numbers. The number of people who died from the Tuskegee problem and the people who are dying now. Thousands.
Yeah. So
hundreds of thousands.
Yeah, as you in the first slide, I don't know if you're there at the beginning. As of today, over 445,000 people have died. So almost 500,000 people in the country. So
no comparison.
Yeah. So as soon as you can get the vaccination, that will help in keeping those numbers as well. They're not low now, but try to reduce any more deaths or illnesses connected to the virus.
All right. Last question. Some teachers are not vaccinated. Students are not vaccinated. Yet students are returning to in-person learning. What are your thoughts?
I think school districts should require that teachers get vaccinated and make it available for them. Like, you know, do an in-service, do a day where all educators, everyone actually in the school system, so that's janitors, if they're doing, you know, cafeteria workers, everyone should be vaccinated. Because those children are going back into homes. They could be potential spreaders to, you know, 5, 6, 7 people. So I think that's the, in my mind, the proper public health response.
Thank you. Anyone else want to comment?
So I think that what Reverend Johnson just said is the gold standard. And I think that if we had enough vaccine right now to do that, I would 100% agree with everything that he just said. I think that, again, this is one of those risk-benefit things. There are some good studies that have come out recently that show that children in school, especially younger children, are not really spreading. They're not really a high cause of community spread. And the CDC is currently recommending that kids do get back to school, even if everybody is not vaccinated. I think that we can do a lot with testing, though I said a little while ago, I remember what I said, that testing is not 100%, but frequent testing. I know some universities, the ones that can afford it, are testing their students multiple times a week, and they're keeping the on-campus students on campus and the off-campus students off campus. There's a lot that we can do to make getting back to school safer without having enough vaccine to vaccinate everyone. Though, again, I agree with what Reverend Johnson said about as soon as we have enough, all of those people exposed and leaving their homes should be vaccinated. Here's the downside of that. The kids that look like us, the black and brown kids, are having a really difficult time learning at home. Many of them don't have high-speed internet access. They don't have good computers, and so they're falling behind. Hard to catch up after a year of falling behind. Many of them are in places where they don't have any space. Kids who are at home cannot escape from abusive homes. They've got parents who are stressed out more. The mental health consequences of COVID-19, not the disease, but the restrictions are significant. Suicide rates are up with children. And so there are a lot of reasons. There are a lot of things to weigh on the risk-benefit side when you're talking about getting kids back to school. It's not only are people going to get COVID-19, that's critical, and it's all the other things that are impacted by kids not being in school. So I don't think there's a simple answer, but the scientific answer from the Centers for Disease Control is we need to find a way to get kids back to school.
Well, one thing that we have learned this evening is that there are no simple answers. This is
except the one that you should go get your shot. That's simple.
Well,
go get your shot.
That is true. Thank you for reminding us of that. You know, this has truly been a very informational session here. You guys have enlightened us and have shared some wonderful information. It's good to hear from the side of someone who is a physician, the side of someone who has actually worked in public health, as well as someone from the ministry as well. And I will, on behalf of the Black Presbyterians United, we will accept your offer to come back. So I hope that you're all willing to come back and share this information. You're absolutely right. We have to get the information out. And we just need to flood our Zoom calls and our phone lines and our messages to our congregations, to our schools. We need to flood all of those institutions with information, the same information that you have shared tonight. Our community is very critical that people in our community take advantage of this shot, of getting this vaccine, and being able to protect themselves as well as their families. So I want to thank you all, Dr. Penn. Someone called him the Reverend Dr. Johnson, so he said he will receive that. And Dr. Walks, thank you all for being on the call this evening. You have truly shared so much information that is so valuable. And I want to thank all of those who joined us this evening as well. And I want to encourage you to take this information back and share it with your family, share it with your friends, with your coworkers, with your pastors, share it with everyone, because the more people who share out, the more people who will get this information. And perhaps that one person might hear it and go and get their vaccine. So thank you so much for being on the call. And with that being said, I am going to close with a prayer.
Before you do that, Dwight,
yes.
Can you just mention that part 2 is in 2 weeks?
Yes, thank you. Thank you so much. Thank you so much. I actually had that written down. Yes, I want to remind everyone that part 2 will be happening in 2 weeks, February 18th at 7 p.m. And again, you will have to register. You have to register so that you can get a link to be able to get on the call. So this is just a continuation of what we did tonight, and we'll be doing more in 2 weeks. So please join us. The more you learn about this, and perhaps the more you'll be encouraged to go out and share it with your family, friends, coworkers, and church members, and so forth. So with that being said, let us pray. Dear God, we thank you for this time of learning, this time of sharing. We thank you, God, that, Lord, by your servants, Reverend Johnson, Dr. Penn, and Dr. Walks, God, we have been enlightened. And we thank you for their willingness to take time out from their busy schedule to speak with us this evening. And God, we just ask that all those who have heard this very valuable information, oh God, will take it back to the people they know, their family, their friends, their coworkers, everyone that they know, that they will share this information. Because God, we know that your people will perish for the lack of knowledge. And the knowledge is here. And we just ask, God, that by your Holy Spirit, you will guide people to hear this knowledge and they will take heed of it. So thank you, God. Continue to bless Reverend Johnson and his ministry. Continue to bless Dr. Penn and her practice, and Dr. Walks and his practice as well. And we give you, God, all the honor and the glory, for this is what we ask through Jesus Christ, our Savior. Amen.
Amen.
Thank you all so much. And you all will be hearing from me or either Shani very soon. Thank you so much.
Thank you.
May God bless you.